Hi, I'm Dave Sheehan, Conference Coordinator for Massage and Myotherapy Australia's National Conference. Next year our conference is in June on the Gold Coast, and on a Skype call from Belgium I have our international presenter for 2018, John Sharkey. John is a clinical anatomist, exercise physiologist and founder of European neuromuscular therapy. He's been a pioneer in our profession, teaching, writing and presenting bodywork and movement therapies for over 30 years. With a special focus on biotensegrity, for the 21st century, John is a recognised authority in fascial anatomy and physiology. We first had John present in 2016 at our Hobart National Conference, and he was so popular, we're extremely excited to have John back in 2018 on the Gold Coast. Welcome, John.
Thanks very much, David. It's great to have the opportunity to speak to members of Massage and Myotherapy Association in Australia, and hopefully also to a wider community, to encourage everybody to come along to the annual convention. You know, it's such an honour to be asked to return. I must have done something right the first time around, and I mean, I had an absolute blast in Australia. I love education. I love sharing. I love, teaching and trying to move things forward. And it was just a fantastic experience for me. And of course, it all happens far too fast. So it's wonderful to come back to Australia, and this time to get to go to the Gold Coast and also to go to Sydney, because we have a number of different events planned, both wet labs, so opportunities for dissection. And if I can say something on that, by the way, I want to make sure people understand that the focus of the dissection is not really for me to point out the path, for instance, of the brachial plexus and to let people know where the ulnar nerve is. And we certainly do that if there's time, or depending on the conversation that's taking place. But I really want to enter into a conversation that does not take place within the typical medical curriculum. Sure. I want to be able to talk about connectivity and connections, obviously about fascia, although it's not purely about fascia also. So hopefully I'm going to bring it into the realm of biotensegrity, which is really a conversation about continuity and connection. So I think people are going to find it fascinating.
And I think we've got APA, Australian Physiotherapy Association, also involved in promoting to their membership as well for one of those workshops, John.
Yeah, it's really exciting for me as well to try to play a role in bridging any gap that might exist between the various different disciplines, whatever stripe that is, if it's osteopathy, if it's chiropractic, if it's physiotherapy, whatever that may be. And this is an opportunity for individuals to come into the dissection lab and to be able to get a new vision, a new explanation of anatomy for the 21st century. And I think what that also helps to do, I think it also helps to raise awareness, first of all, about the differences between the disciplines, and therefore it nurtures a respect of one discipline for the other. Because, for instance, in my own case, I have colleagues and friends of mine who are osteopaths or chiropractors or some other type of practitioner, and I will refer patients to them if I have made the judgment, an informed judgment, that it is that particular type of intervention that is required. Now, over the years, I've had some people that have stolen my patients and didn't return those patients to me. So perhaps I either spoke to that individual or else I stopped referring. But to be honest with you, I've got a fantastic network, and they will do the work that they feel is required. I don't tell them what is needed, because they're specialists in their field. But I would have a suspicion and a sense that osteopathy is the right way forward, whether that's a low amplitude maneuver that's required. And then once the person has received that type of intervention, then that patient returns to me. And I love this building of a network. That's what we really require. We need these networks in order to be able to ensure that our patients are getting exactly what they need, because we're limited in we can't have every solution to every single problem. So the myotherapist and the massage therapist, they offer certain things, and so other disciplines, whether it's physiotherapy or whether it's osteopathy, they offer something slightly different. And so it's great to have this building of networks.
For sure. And when you talk about low velocity, of course, that comes within the scope of massage therapists, remedial therapists, myotherapists as well, which is what
Excellent.
our conference is aimed at as well, as far as our membership is concerned. John, did you want to talk a little bit about your keynotes? Now, I think by memory you're doing a keynote to open the event, and we're also having you teach hands-on, but also at the end of the event as well. So there are two keynotes where you're talking and presenting, and then there's the hands-on component. But did you want to talk a little bit about those two keynote presentations?
Try and stop me, Dave. You bet I do. Again, I'm super excited. Here I am in Ghent, in Belgium,
sure.
And I'm with Dr. Stephen Levin and our family of biotensegrity interest group, and I suppose everything that I teach is peppered with biotensegrity, or influenced by biotensegrity, informed by biotensegrity. And so one of the keynotes is the only word, the last word. And the reason that I framed it that way is that I think this is a really exciting conversation for us to have. And it's so poignant to have the conversation, right now. And that is, have we had the last word? Have we had the only word on almost any topic you can think of within bodywork and movement therapy? So, and I'll give one or two little points away. An example, for instance, would be we have an international guideline in terms of bodywork therapy. So let's take massage. Within massage, we would say that we should always massage towards the heart. So part of what I want to do with this presentation is I want to raise, first of all, awareness within the various professional bodies, starting with Massage and Myotherapy Association, because, for instance, I cannot do it on my own. It needs to be in conjunction with the authorities, who will take a look at the current information that we have and then make a decision, which is going to lead to standards and guidelines for our professionals. So we have the standard and guideline of always massaging towards the heart. Why? Where has that guideline come from? You see, as a clinical anatomist, I can tell you that the structure of the arterial and venous system, in fact, it's the structure of our nerves as well, but the structure of our arterial and venous system is based upon anastomosis, which basically means that blood gets to where it needs to go, regardless of which direction you massage or regardless of what type of tensional or compressional technique that you use. It's a little bit like squeezing a tube of toothpaste. It's closed at one end. It can only go in one direction. And it doesn't matter how you squeeze the tube. It doesn't matter which direction the force runs. The toothpaste can only go in one direction. There are really only two cases, and this is a typical Irish situation now, to be sure. There are only two cases in which I would say that, I would say be careful and perhaps massage towards the heart. And that would be with individuals who have varicosities, varicose veins.
Sure.
So they have some pathology in the arterial system or the venous system, more specifically, or indeed individuals that might have some specific coronary problem. But to be honest, there's no evidence to say that massaging down the leg would be of an issue for those. I'm simply saying, to be sure, let's be extra cautious, let's be extra safe. So I don't believe we've had the only word or the last word in terms of circulatory system and how massage affects it. And I'd like to see us, the Association of Massage and Myotherapy, for instance, leading the way in changing this international guideline and saying that we no longer have to massage towards the heart because it doesn't make an awful lot of sense. The second keynote, if I'm not mistaken, is in relation to dry needling. Am I correct in that?
Yeah, we're doing frozen shoulder from a biotensegrity viewpoint.
Oh yes, well, frozen syndromes actually. One of the workshops is on dry needling. Since I mentioned dry needling, can I do it in reverse? Can I just mention,
of course, absolutely,
in terms of continuity, because one of the things I was talking to insurance underwriters over in the UK just recently, and it amazes me that people seem to be very confused in relation to what dry needling is and where the term dry needling came from. So let me just explain something very quickly. Dr. Janet Travell and David Simons are the mother and father, basically, of the science behind myofascial trigger points. They're the individuals who wrote the famous big red books, Myofascial Pain and Dysfunction, the trigger point manuals. And what happened with Dr. Janet Travell, basically, was that Dr. Janet Travell was teaching doctors. She was teaching doctors how to find myofascial trigger points. Now, my opinion would be that for the most part, a doctor, a GP, doesn't have the same palpation skills as a massager or myotherapist, doesn't have the same topographical or gross anatomical knowledge. So their ability, for instance, to palpate and differentiate between sternocleidomastoid and the scale knees, or where the levator scapula is, it wasn't quite up to the same standard that I think that bodywork therapists can bring to the table. And Janet Travell was trying to provide a map, so she was using X's. We don't use the X's anymore in trigger points, but she was also using needles. She was using hypodermic needles to deliver a wet solution, something like lidocaine. So something like this, so that it would numb the area. Now, what they discovered, in fact, was that there was a needle effect separate to the delivery of the solution. But secondly, she wanted to find a way of being able to teach the doctors how to do the needling, but she didn't want to use a wet solution because these things cost money. So she was using a hypodermic needle with no solution, and so she decided to call that dry needling. So I just need to make the point clear that dry needling has not come from the acupuncture world. That is not a term that they came up with. That term came directly from Janet Travell. And so my focus is on dry needling, which is targeting myofascial trigger points. I'm not an acupuncturist, nor do I ever try to talk about that aspect, because that's not part of my stripe. I mean, I respect and acknowledge acupuncturists, but that is what the focus is going to be. And the other aspect of that, as well, is I really want to talk to people about safety and appropriateness, because what you can do with a needle is you not just cause harm. People always say things like pneumothorax. You can actually cause death with a needle. So I really want to take the opportunity to be able to talk about anatomy and the importance of anatomy, and understanding that you need to know where the needle is at all times. So that's going to be a big focus. Of course, I'm a clinical anatomist, and so obviously anatomy will be a big focus on our conversation. And so then the other topics are on frozen syndromes. And I'm really taking that term, by the way, from my colleague Robert Schleip, because Robert spoke about frozen back. Everybody knew about frozen shoulder, and Robert, proposed this idea of frozen back. I thought it was a super cool term to use, and so I've taken that. That's basically what I'm doing, because at the end of the day, if I take the topic of frozen shoulder, for example, we will have bodies, donations in the dissection room, and we get the details. And the details may say that this individual had frozen shoulder. So I'll say to the students, please don't do anything with the shoulder until you call me to the table at the time that we're coming to the shoulder, because I'm really interested in taking a look at that particular person's shoulder. And I can tell you that I'm 30 something years doing dissection, and over those years, I've never actually seen an adhered capsule. And yet this person was diagnosed with the term adhesive capsulitis or frozen shoulder. So the idea then is, well, what's going on? And believe it or not, many bodywork therapists, we truly understand. It resonates with them when they hear somebody saying, you know what, you have a problem in your shoulder, but that's not really where your main problem is. Your shoulder is like the squeaky wheel. And they understand that. But you have to put a language and a vocabulary to it. You have to explain it to people in such a way that they can build the skills to be able to identify the true source of the person's problem. And this is really where the biotensegrity aspect comes in, because in terms of biotensegrity, you could have, for instance, if I move my fingers, where is that movement coming from? Well, from a biotensegral viewpoint, it's actually coming from back here. So you have to join me. You have to take that journey with me so that I can explain to you why it is that somebody can grab a bar and pull themselves up and down from the bar, because you can't explain it in terms of, even working on my computer. There are no muscles out here. So you have to be able to explain it with a different rationale. And that rationale really comes from biotensegrity. So I'm hoping that people will find that really exciting. And obviously from the feedback that we're receiving so far, people do find it exciting and it does resonate with them.
Absolutely, John. And it's look, it's really wonderful to speak to you before the actual conference that's coming up in June 2018. We're talking about your involvement in the 2018 Massage and Myotherapy Australia conference, which is taking place on the Gold Coast. John, we had you out here in Tassie, out in Tasmania 2 years ago, and I do remember that your actual workshop sold out very quickly. So I'm putting it out there to members who are coming along and are looking at registering. Try to register early, because John's workshop did sell out really quickly. That's the dry needling workshop this time around, which is on the program. You'll be able to see that through our brochure and also online. John, is there anything else you want to talk about before we head off? And you've got busy stuff going on there today. It's early morning there for you.
It is. Well, the last time I was over, I was doing a book signing, and I have a number of books. There's 2 books that have been published since. So I'm jumping to a conclusion here, but I'm assuming that we may have an opportunity for book signing again. I love meeting people. I love getting the opportunity to write something personal into a book. So if people are attending and they want to purchase a book, the book that I've written on dry needling, and they want me to sign that, I'm absolutely thrilled and honoured to do that. It's just going to be a real blast. It's a fantastic opportunity for me to come back and to meet my Australian colleagues. So please get on to massagemyotherapy.com.au.
Yeah, perfect.
And all the details will be there, Dave, will they?
Absolutely. That way, and also via the journal. The next journal that's coming out will have a hard copy brochure. So for those that are still doing it that way, the registration, handwriting and sending it in, then we're doing it that way. Plus there's also the online registration. So absolutely.
And also people can join me on john.sharkey.369. I think it's 369. If you put in John Sharkey Anatomist or John Sharkey Dissection, something like that, I'm sure you'll find me on Facebook. But yeah, and I'm an old dog. I know I should be on Twitter and I should be doing all these other things. I'm on Facebook, and I try to post, some regular information there. So please come and join me on Facebook as well and communicate with me. I'm delighted to meet and speak with people and answer questions that you may have. I love to hear from people, so there's no problem with you sending me an email. And I will always give me a couple of days, by the way, because sometimes I can be in a country where the internet is not that great. And so sometimes you have to, find, like typically, and this is terrible, find a McDonald's. McDonald's usually have good internet.
Well, we tried this 2 nights ago, but I think half the roofs of Dublin were off after a hurricane. And you walked down to the local cafe, so that was great. Hey, one other thing, John, on the Friday before the conference, you're doing a pre-conference workshop, right? Which is hopefully a wet lab, is that right?
It is indeed, yeah. And then afterwards, I think we have the meet and greet.
Ah, very good.
Am I wrong?
So you're all over it. Yeah, so I was going to mention that. So we'll be heading down probably to the Star Hotel, which is the old Jupiter's, where we can meet and greet the presenters for the conference, which is going to be lots of fun. And I think the first 100 people who register on the Friday afternoon will get a drink card, which is another incentive, isn't it? Love to be here.
Well, I think it's going to be a magnificent evening. We'll all be nice and relaxed. And once again, in case people kind of tend to think, there's the presenter, let's not go up to him. No, come up to me, eyeball me, shake my hand. I'm John Sharkey from Dublin, Ireland, and it's really just about sharing. It's about, taking the knowledge and skills that I've acquired over the last 30 years. You don't have to agree with everything I'm saying. That's not what it's about either. I love a good discussion, a good conversation, but come to the event and support the work that Massage and Myotherapy Australia are doing, because I think it's really pioneering, and it's breaking new boundaries. So please come and support this work. It's fantastic.
All right, John. Well, we'll leave you to it. Once again, thank you so much for your time today. And where are we now? We're in the end of October for this interview. So by the time this goes to air, I think in a couple of weeks we'll be heading into November. And then we're going to see you in June 2018 at the Massage and Myotherapy Australia National Conference in June on the Gold Coast. So thanks again, John, and have a great day.
Listen, you too, Dave, and well done, and congratulations to all on the committee. I think you're doing a tremendous job, and once again, I'm being blatant about it. Please come and support this annual conference, and see you in Australia next year. Take care.